Elaine. Elaine will be doing the intro today. So delighted to have you here, Doug, and thank you, Elaine.
Hi, everyone. Can you hear me okay?
Yes.
So wonderful. I'm so delighted to introduce my good friend and colleague, Dr. Casa. And I want to highlight a couple things about his bio before he presents. So Dr. Casa's passion for preventing sudden death in sport, occupational, military settings, and optimizing sport performance comes from a really inspiring and remarkable personal success as an athlete, and a compelling story about a near fatal heat stroke, exertional heat stroke that he experienced as a young athlete in 1985. I want to just kind of put out there that as you listen to his talk and follow up and think about things, to please go visit the website for the Corey Stringer Institute at ksi.uconn.edu, because it talks a little bit about, in a few videos that are available on the website, his story, establishment of KSI. So, since that event, he's dedicated his life's research to understanding etiology, pathophysiology, prevention, policy related to exertional heat illnesses and sudden death in sport. And in 2001, he was asked by the NFL and Kelsey Stringer, a widow of a Minnesota Vikings NFL football player, Corey Stringer, who died tragically from exertional heat stroke. And so this year marks the 15th anniversary of KSI at UConn. So Dr. Casa is the CEO of KSI and is a Board of Trustees distinguished professor at UConn in the Department of Kinesiology. He was inducted into the NATA, National Athletic Trainers Association Hall of Fame last summer in June. And his mission, again, is to provide research, education, advocacy, and consultation to maximize performance, optimize safety, and prevent injury and sudden death for the athlete, warfighter, and laborer. He's an editor of many books and multiple scholarly works. And I just want to highlight before you hear some of the things that he has to share today that his curriculum vitae is over 125 pages and counting. And this kind of life's work includes over 400 peer-reviewed publications, book chapters, and Dr. Casa has presented more than 600 times on subjects related to maximizing performance in the heat, exertional heat stroke, and heat-related illnesses and hydration. He has an astonishingly high H-index, a scholarly index of 66. And he's a clinician, a licensed athletic trainer, and he's treated more than 400 cases of exertional heat stroke with 0 fatalities with his care. So additionally, I just want to highlight that globally he's sought after for his consultation and work. And from 2018 to 2021, he served on the International Olympic Committee Adverse Weather Impact Expert Group for the Olympic Games in Tokyo 2020. And, he's had such impact here locally. We're very proud to have him at the university, and he's had national and international impact and continues to do that with also, to me, the most remarkable thing is a lot of care and mentorship to his students and trainees. So I'm so delighted to introduce Dr. Casa today for this seminar.
Wow. I'm going to take Dr. Lee with me everywhere to do introduction. Can you guys see my slides?
Could you please hit the present button? Thank you. But yes, we do see them.
That for
it's sort of in the presentation in the bottom right. There's a.
Oh, I got it. I'm sorry. Is that what you mean?
Perfect.
Awesome. Seriously, Dr. Lee, thank you so much. Dr. Lee is literally one of the most important people in my entire life, an amazing colleague and friend, and amazing what we've been able to build together with her lab and expertise and KSI together here over the last almost 2 decades. So happy to be here. My goal today is to give you a little bit of a snapshot of some of the work that KSI does, not to do a deep dive in any specific area. As Elaine had mentioned, we have over 100 people working at KSI this semester. So there are a lot of different avenues that we explore related to labor, warfighter, and athlete. And I'm going to just kind of give you a snapshot of some of these items right now related to this topic. As was mentioned, we were founded 15 years ago. That's Commissioner Goodell there from the NFL, when Hay and the widow of Corey, who's in the middle of the picture there, had the wisdom to establish a lasting legacy for Corey. And that's our Corey Stringer Institute here at UConn. We have an annual report that comes out every year that's online. We have a 5-year evaluation that we do at UConn. So if people wanted more information, they certainly can get that. We always disclose that we have 9 corporate partners. We also get money, obviously, from research grants. I get money as an expert witness, honorariums, and things like that. As was mentioned, I've been at UConn for 29 years in total, if you count my PhD years. The last weekend, we went to the women's Final Four down in Tampa with a lot of family members. 2 of my kids go to college down in Florida, so we had a blast. Been a big fan here. I'm an alum of UConn, and so is my wife. And my wife's also a professor here. So we're very entrenched in this situation, but I thought you'd find it funny. When I arrived in 93, UConn had 0 basketball national championships. So I'm just saying now, since I arrived, we now have 18. So I do believe I'm partially responsible for some of that. Elaine just mentioned some of these things before, so I won't reiterate those. But 2 things in addition is I've been an expert witness on about 80 cases related to laborers and athletes. And you do see things uniquely in cases that you see when things go wrong and things that could maybe potentially be fixed. Elaine also mentioned I had a heat stroke almost 40 years ago. This August 8th, it'll be 40 years since I suffered my heat stroke, which certainly set me on this path. This is the person who saved my life. I never do a presentation without his picture. It's Kent Scriber. I found out 16 years after I had my heat stroke that this was the person who treated me that day by some serendipitous occasion of giving a talk and someone hearing my story who had heard the story from him years ago. So that's very special. I also want to just thank some of the people here. These people help with some of the slides for this presentation that I've used in this today and I've used in the past. So I want to make sure they receive credit. It was mentioned before, but the mission of our institute is to enhance performance, optimize safety, and prevent sudden death for the athlete, warfighter, and laborer. So I want you to think about that as we talk about these items today. Also, for people that are unaware, our labs are in Gamble Pavilion, where the basketball team plays their games, is where the Department of Kinesiology is located. We had a beautiful heat lab built in 2017 with the help of UConn and a lot of generous donors. This is an environmental lab that we do a lot of physiological, medical, clinical kind of testing, where the lab can control the temperature between -20 and 120 degrees, humidity from 20 to 90%, full cloud to full sun, wind speed from 0 to 20 miles an hour. We're very fortunate the university is supportive to build an even better state-of-the-art heat lab that's also going in Gamble Pavilion that's bigger and better and also has capacity to change altitude up to 12,000 feet. We're very, very busy within our current space, so we'll now have 2 facilities, state-of-the-art facilities to do the research that we do. I also want to mention Corey Stringer Institute is having its first satellite heat lab be built at the University of North Florida in Jacksonville, because we've realized we just need to be closer to laborers and military members who are doing work in the heat every single day, all day. So Jacksonville has over 100,000 laborers within 1 hour of their campus who work in the heat every day. So this is extremely exciting growth. The University of North Florida is paying for everything. They're building 2 state-of-the-art heat labs. There's a brand new building going up where KSI will have a big footprint. So this is big for us to grow in terms of the labor space especially, and the increasing needs, which we'll talk about during this presentation. So this is very exciting. So when we're talking about specifically, the theme of this talk is, a warming climate, right? Global warming. Scientists could have never predicted it would even happen as fast as it is happening right now. And if you just look at the left and the right part of this graph, the heat wave frequency and the heat season. I was born in the 1960s, and you look up to the 2010s, heat wave frequency has tripled just in my lifespan. And the season length of the heat season has also tripled in that time. That's an amazing when you think in the grander context of life on Earth as humans or just Earth in general. That in just my lifespan, you've seen this kind of growth. So very interesting, obviously, that, obviously the tendency is this is going to continue to grow and maybe obviously exponentially. And it's important to understand this because we've done a lot of research. This is just one snapshot. That's the wet bulb globe temperature, which is just a metric of the environmental conditions and the thermal load. As that increases, the risk of heat stroke, for instance, increases, and the risk of heat illness increases. This is a snapshot from one road race, but it just conceptualizes that, we have to be very concerned as people do activity in gradually warmer conditions. And which, populations do we care about? And we talk about, there's just construction, which is just one small subset of laborers in America who work in the heat, is 8 million. There's profoundly more farmers, as an example, oil and gas workers, people in the train industry, people who do road work, things like that. So, and there's also over 8 million just high school athletes in America. Many of them have to do their sport in the heat. In the military setting, the heat stroke is always one of the top 3 leading causes of death during training. So these are just some people and populations that we care about in these settings. So when we're talking about climate, like I am not a climatologist, I'm not a climate expert, but to just kind of set the stage for some of the things we're going to be talking about, when we talk about, someone says the weather versus climate, weather is your mood and your climate is your personality, if you want an analogy. So in other words, weather can vary from day to day. Climate is more consistent and is often based on statistical measures like average temperature. So when we consider that, when we think about global warming, it's a couple things you need to consider. First of all, the mean is obviously increasing. I have a couple other slides to show you that very specific to this. So the mean is increasing, but also the variance is dramatically increasing. So when you take those two together, there's more variability, but also hotter weather in general. So that makes, first of all, a lot harder to predict, and there's a lot more days that are worrisome. So it's not just, obviously I care dearly about the heat wave side of this because that's what I research and what's going to affect the populations that I study, but it obviously, these climate changes affect a lot of other things that will obviously have massive impact on quality of life and health and cost. But just this is a good take-home slide for generally seeing the temperature changes. This is the history of, at least of when we know the environmental temperature specifically. And you can see basically, like, if you look at like my lifespan from the 1960s forward, it's basically gotten hotter on Earth every single year. And, pretty dramatically so in terms of the how things change. This is an example just of the southwest part of America and some of the most oppressive conditions. It was over 115 degrees for a record consecutive 6 days at one point in 2021, and it's only gotten hotter. In 2023, in July, it was over 110 degrees every single day. This is an example. What I just mentioned to you is actually, to be really truthful, it was every day except the 31st, but the lowest high temperature in the month of July in 2023 was 108 degrees. And this is nothing like they had seen even just 20 years ago. So it was interesting that I have a friend who lives in Phoenix, and all of the cactus that live on his property have died because it's not getting cold enough in the nighttime for that plant to rejuvenate. So it scares me a little bit when cactus can't even survive in the hot conditions. Another, just when you look in Portland, Oregon a few years ago, they had 3 days that it was hotter than any days in recorded history in the span that they had measured in about a 40-year stretch. And this is during that same time frame. And I know this because there was a really high-level track and field meet going on in Eugene, Oregon, and they had to change a lot of the events related to temperatures in Oregon, reaching 110, 112 degrees, temperature you don't typically think about for Oregon. This looks at globally, and when people have to do work, for instance, physical work capacity during declines throughout the century. And just think about this. This is like now, the last 20 years. This is predicting, 15, 20 years from now. And this is at the end of the century. And you can see there's certain pockets of the world that it's going to be maybe only half the time or a third of the time you could work in the heat because it's just going to become so oppressive. This is similarly to that graph, very specific, like to the southwest portion of the United States, looking at how things will gradually change. And here you can see different time spans over time, and how there'll be more and more times that it'll be too difficult to even work outside. We'll probably see a lot of laborers moving, like farming, construction. The work will just only happen in the nighttime because it'll be almost impossible to do during the day. So here at KSI, we do a lot of work in the laborer setting. Here you see us with Delta Airlines. Delta Airlines, for instance, and UPS, two companies that I'm sure you recognize, are two companies that that KSI provides their heat mitigation services. We act as a consultant to their leadership to help them make heat strategies. We help the military a lot related to the heat. We've had 18 Department of Defense grants in the last 6 years. And obviously they're all related to issues of exercising in the heat. But also we've helped a lot of athletes prepare for exercise in the heat. If we have any soccer fans on this WebEx right now, Dr. Huggins and myself helped the Portugal national team back in 2014 in the 6-month lead up for that particular World Cup. For some games, they had concerns about being in the heat. We help U.S. Soccer in America develop their website and a lot of their heat strategies. They're very proactive with U.S. Soccer with heat safety, and we were fortunate to assist them. We help the U.S. women's national team. Again, if we have soccer fans, the whole team trained in our heat lab for the 2 weeks leading up to the Tokyo Olympics so that they would be prepared for the oppressive temperatures in Tokyo, which I'll talk about in a second. We helped Qatar, the country that hosted the World Championships for track and field in 2019, and also helped their medical staff prepare for the World Cup for 2022. We have had articles that came from some of those experiences. This is in 2019, our learnings to help prepare for the World Championships for track and field. We had the marathons running at midnight because that was only 90 degrees at midnight. They moved the event to the end of September, beginning of October to make it a little cooler. But anyway, just a lot of things that we had a role in helping shape the outcome of that. So it gives you an example of some of the craziness of that you had to do to try to deal with the heat. Obviously, the uniqueness of actually, first of all, having it in Qatar, makes it a little more challenging in terms of having heat safety strategies. So this is an example. A midnight marathon when the World Championships was happening. We also did a lot to help the International Olympic Committee prepare for Tokyo. As Elaine mentioned in my introduction, for 3 years, we helped them design when the events would be at different venues. But very importantly, Dr. Hasakawa, one of my former PhD students, helped train all of the medical staff that might have to deal with heat stroke at all of the venues for the Olympics. And that preparation over the course of 3 years, I think was very valuable for their preparation. And one of the reasons we had done that is we had published papers showing that the Tokyo Olympics would be hotter than any previous Summer Olympics in history. And it did turn out to be the hottest Summer Olympics in history. So this is just a reiteration of what I just said. We had also publications that came from this as well, some really important ones, and some resources that are available now for people who will be hosting events in the future in the heat. This is an example of just one of the papers. Another paper we published for the Tokyo Olympics. We looked at every single sport that's in the Olympics and the percentage of time that they had planned on it competing during the middle of the day to see if we need to either change the time or change the mitigation strategies that are in place for the event. I mentioned to you the World Cup before. It helped a lot with the medical staff in Qatar. That's because it was just so oppressive. They moved the World Cup for the first time in history from July to November, December to just get it down from the a little bit, and it's still oppressive in November, December, where the average wet-up club temperature still can be in the mid 20s Celsius. I mentioned this too because America's hosting actually 2 World Cups, the Club World Cup this year and the Country World Cup in 2026, and many of these cities will be in some very hot locations. A few of them are indoors, but many of them outdoors. And we've also had interactions for the Paris Olympics this past year, and obviously LA is hosting the 2028 Olympics. So other things to consider in the sports venue. I'm going to quickly mention just 3 educational resources if they could be helpful for you. TED-Ed came up with a what happens when you get heat stroke video that's 4 minutes long that might be helpful in different settings that you interact with people. The NFL created a really state-of-the-art video for medical staff and leadership. At NFL Play Smart, Play Safe. It's 12 minutes long, and they spent $150,000 on it, and it's really well done. I also want to mention Stephanie Kuzadim came out with a really extensive article looking at every death that had happened in sport, high school sport in America over the last 20 years. So these are just 3 good resources if you want additional information from an educational perspective. I want to mention to you 4 really big public health initiatives that KSI is involved with that are very tightly connected with heat safety. Okay, the top left is Atlas. That's our effort to keep track of athletic training services at all 21,000 high schools in America. The National Athletic Trainers Association and KSI partner in that. Dr. Huggins here at UConn coordinates this for us. Athletic trainers are the licensed healthcare professionals who are specifically trained to prevent, recognize, and treat medical emergencies, and are, they're located in 2/3 of the high schools in America and all colleges and pro teams and things like that. So we're very interested in getting proper medical staff there to take care of heat and other medical conditions. Dr. Stearns, my colleague here at KSI, coordinates Tufts Team Up for Sports Safety. I'll talk more about that in a second, but that's our effort coordinated with NATA and NFL to try to enhance health and safety policies for high school sport. Innovate, Dr. Eason, our colleague here at KSI, coordinates, and that's our effort to enhance athletic training services in traditionally underserved communities in America. Again, because we care passionately about having proper health care for high school athletes. And NCCSIR, Dr. Stearns runs this one as well for us. We coordinate with UNC Chapel Hill and University of Washington. We keep track of every single death that happens in youth, middle school, high school, college, and professional sport in America. And we investigate each death. And we're in charge of all the exertional non-cardiac deaths, so things like heat stroke and exertional sickling. And in those investigations, a lot of research publications have emanated because we learn tendencies of when these deaths take place, and that can influence how we shape policy. So I said to you before, Tufts is our efforts to enhance health and safety standards for high school sport. This is our states we have visited so far in yellow. Many states we've visited twice. We assembled 20 to 30 people in each state to try to enhance health and safety policies, whether it be legislators and the State High School Athletic Association. We've done over 75 visits altogether because many states have had more than one. So we've been doing this for over 5 years. But some of the reasons we do that, some of the things when we are inside these states, we're trying to enhance health and safety standards, but heat is one of the big ones. So many of you may or may not know, Louisiana, just as an example, is the hottest state in America for wet bulb globe temperature in the summer. And then, so we did this vulnerability map to see what are the hottest states in America, and then what do they have in terms of heat policies. So when we started, Louisiana had 0 heat policies. Now, thankfully, they have all 20. But they did it after a bunch of athletes died from heat stroke. We got to give credit to states like New Hampshire, Vermont, New Jersey that have been proactive with their policy changes, didn't wait for a heat stroke death to happen, whereas other states were often reactive. I still give them credit for making the changes, but these are things like heat acclimatization, modifying based on environmental conditions, having cold water immersion tubs available for heat stroke treatment. It's just an example. These are just an example of things we're doing when we visit these states. Okay, so we published an article back in 2021 to see how much policies states have made after we have these Tufts meetings, and you get an idea on a 100-point rubric. Some states have made massive changes to their health and safety policies in a lot of different content areas. But something exciting, we recently were able to report this past fall that there's been 316 new policies adopted since we started these visits for Tufts nationally. And there's been many, many others, but they didn't quite meet the threshold for our standard for best practice, but they still moved the dial forward. So that's very exciting to see the fruits of our labor for many years and a lot of traveling. Because at the high school level in America, you may not know that health and safety policies are done at the state level. There's no federal organization that mandates policies. As an example, a state like Florida was so proactive that they established all the 20 points and then went to every single high school in the state to see what they were currently doing and what needed to be changed and how many high schools would have to make that change. So this is a 20-something page report they had is just an example of how proactive they were there. And Florida and Georgia are the 2 top states right now in terms of the number of policies that are available for high school sport. And this is an example of, we had recently last week done the Pennsylvania meeting. So it gives you an example of some of the stuff that we're looking at when we go do these visits. This is our evaluation. Some states are not thrilled that we publish this on our website, but Vermont had just had one of these Tufts meetings, and now they're going to be in the top 5 in terms of health and safety policies for high school sport. I told you before, Florida and Georgia are certainly leading the way, but New Hampshire, Vermont, Louisiana, New Jersey, doing quite well. I want to make it because it's also parallel. Many of you may not realize that people are more likely to have cardiac events when they do exercise in the heat, whether it be a laborer or an athlete. So we're working closely with the Smart Heart Coalition, Smart Heart Sports Coalition with the NFL to get EAPs in place, AEDs accessible, and coaching education. This is an example of the states that have these policies in place right now. Green would be, they have all of them. And unfortunately, the red would be states that have none of them. So 19 right now have all 3 of these. So this is also important for moving the dial forward. Example of some big momentum changes. California recently added coaching education. They also added emergency action plans specific to sports and that it had to be rehearsed. Very hard to get things changed in California because of the enormity and the structure of that state. So it's exciting. I also want to just give credit from some of that NCCSIR data. When we look at deaths that happen in high school sport, Dr. Stearns just last year published this data set over a 40-year stretch. And not surprisingly, heat stroke deaths in high schools happen in the summertime. But it is important, like making sure we have medical staff when we're doing conditioning sessions with high school athletes, like in July, even though school's not in session. She also had another study, very importantly, to find that within the sport of football, 100% of the deaths were very specific to a position, like they're all linemen. And sickling deaths, they're all linemen. So that's really important for shaping policy on how we need to condition and train certain athletes different, even within a specific sport. I want to mention also one of our alums who's an expert on emergency action plans recently published this paper related to best practices related to emergency action plans. And it's just really important to conceptualize this because heat safety emanates really ultimately from having appropriate emergency action plans in place, whether it be a work setting, whether it be the military, or whether it be athletics. I mentioned to you Innovate before, our effort to get athletic trainers in traditionally underserved communities. Dr. Easton coordinates this. We're super fortunate now that we have had, I think, 5 cohorts and maybe upwards. This map's not even the most updated one. We now, I think, of servicing 20 different school districts in America with their first ever athletic trainers at their high schools. Dr. Huggins coordinates our athletic training services. This is our current, one of our current maps. Looking at every state in America and how many have access to athletic trainers. Again, the licensed healthcare professional that can deal with these heat emergencies and other kinds of medical conditions. And why we care about all of these things with an athletic trainer being present is that the survivability from heat stroke precipitously drops off based on the number of minutes that you're severely hyperthermic. So the number of minutes you're over 104 is going to dictate if you live or die. And we're always trying to keep that under 30 minutes. Which dictates a lot that we have to do some of this care on site. And it also dictates a lot of our research that we've done. One of the things I'm probably most proud of is the work we've done over the last 25 years, really changing the global approach to heat stroke care. And that would be one, how we care for them, and finding that cold water immersion has profoundly faster cooling rates than other traditional treatments for heat stroke, but also realizing that we have to cool the person on site. We can't transport them to the hospital until the cooling is done. If medical staff are present, and that concept is called cool first, transport second. It's really important to understand this because in the laborer space, a great amount of work settings don't have immediate access to hospitals within 30 minutes. So that work setting needs to have a plan in place to cool that person down because the average start temp for heat strokes like around 108, and we have to get them down under 104 within 30 minutes. So we have to have a plan to do that on site. Dr. Stearns published another paper. She was very productive last year related to 454 heat strokes and 100% survivability if they had on-site cooling via cold water immersion and their temp got under 104 within 30 minutes. So this is another way of looking at some of the cooling rates. These are different ways of cooling people, but again, all of the ones to the right of the red line are cold water immersion. And we've done really a lot of the studies in this space to help people understand which modalities have the best cooling rates. So one of the things when I mentioned before in the laborer space, Dr. Morrissey, the lead author here, made a profound effort and a really important contribution to literature when she published this a few years ago, because it was really one of the first kind of consensus statements related to best practices for laborers who have to do their job in the heat. She assembled 52 of the world leaders. She broke it up into 8 different component parts, which I'll show you in a second. But the reason that she was leading this effort is that heat is the leading cause of exertion-related death in America for workers. Okay, so it's obviously a really important issue. Thousands and thousands of people die worldwide in the heat every year. These are the 8 component parts that she broke that article up into different things that companies can do to protect their workers and also things to consider if a heat emergency does happen, what they would do. I mention this because it's important sometimes to look backwards to understand, what we're trying to do has often been done before and how we can do it better. Back in 1969, the World Health Organization, obviously the leading organization in the world related to these kinds of health concepts, published an article, the first that we know of really in terms of a consensus related to health factors involved with workers in the heat, and a lot of lessons to be learned there that we're trying to apply today. An important article to kind of conceptualize some of the things that we look at when we help laborers in the heat and also athletes, but especially workers, is an article that I'm going to share with you, but there was another article also that came out recently with women. There's a lot of specific issues that have to be considered for women that have often not been considered in recent studies. But these are some of the things that we look at with these studies. You know, when we look at research studies, we're looking at like body temperature and how hard the people are working, their physiological response, like their heart rate. And these are the things we care about, like are they acclimatized during the study? But so few studies have done with females. Half of the workers in America who work in the heat are females, but yet less than 10% of all the studies have been done with women. Okay, and very few have been done in the field. A lot of them are laboratory studies, so they really can't recreate 12-hour work shifts in 120-degree temperature for people who have comorbidities and they're on medications. So we really have to expand our learning because it's really in the most basic level right now of understanding the physiological stress and the medical issues for laborers in the heat. I mentioned to you this just now. Dr. Morrissey also published this article. I mentioned about half of the workers in America are women, but less than 10% of all the studies have included women subjects. So I mentioned to you some of the organizations we work with before, many others, but these are some that you would recognize. But when we're talking about these laborers in the heat, why are laborers different than athletes and different than soldiers? Laborers are very different because they're generally could be 40, 50, 60, 70 years old, and they have other medical issues, and they are on a lot of medications, and they're doing 12-hour workdays instead of a 2-hour practice. And a lot of times they have to do their job. They can't call in sick. So they go to work with viruses and other illnesses because they can't not have their pay. Because a lot of jobs you would not receive your pay if you don't work that day, even if you're sick. So there's what on this slide was individual factors we have to consider when we're talking about laborers that are very different than sports and military, but there's also structural things that are within work settings that we have to consider that are very different within a lot of more controlled settings that we see, especially within sports. All right. So how does the risk change for laborers? Public Citizen, a big public watchdog group for laborer safety, has found a 1% increase in injuries for every 1 degree Celsius rise. And it's not just heat injuries, like you're just more likely to have problems with concentration or fatigue, and you might make mistakes that influence other accidents that happen at work. So it's not just heat illnesses. But we've also had success trying to explain to companies that productivity dramatically decreases when you have to do your effort in the heat. And sometimes the jobs care more about the productivity than necessarily the health issues that we chat about. So these are just some of the things that could influence things that affect their physical work capacity. And we've done some recent publications here at UConn that have shown that just simple mitigation strategies like shade, cooling with just cooling towels, and hydration can really have an important influence in keeping temperature down, heart rate down, and allow the person to be more productive doing a physical work task. All right, so it's kind of just reiterating things related to productivity. So when a person's working in the heat, there's productivity issues, but there's also acute health issues, for instance, like someone having a heat stroke or a heart attack. But very importantly, and really novel and new with studies just coming out in the last few years, there's a big issue related to chronic health issues. When someone works in the heat for 12 hours a day for 20 years in a row, we're starting to understand there might be big issues related to, for instance, kidney function or cardiovascular function or other things like that. And that really might amplify costs for companies related to workman comps and other long-term disability issues for workers. So we're trying to understand that more. One of the big issues and reasons why we're opening the facility in Jacksonville, so we can have more proximity to those workers. This just gives you an example. I think it's a decent analogy here. Last year, the Department of Homeland Security had a budget of $51 million, and HUD, Housing and Urban Development, had a budget of $44 million. And annually in America, we lose about $100 billion annually because of productivity issues related to heat-induced labor cost issues. And that's speculated to increase to $200 billion by 2030 because of global warming, and up to $500 billion by 2050 due to global warming. So because of how big this is, recently the United Nations Secretary General's released, this was just last year, released a call to action related to extreme heat. They think that there's about 2.41 billion workers that could be exposed to the heat. It doesn't have to just be people related to their job. It could be people just getting their own food and their own water who are exposed to extreme heat. But there's a lot of injuries and there's a lot of deaths. We think this is grossly underreported, 19,000 deaths annually, because a lot of deaths are just not reported. For instance, if people are not citizens of the particular country in which they die, we have a lot of evidence that those deaths are not reported. And you can see the increase that's happened just since 2000. Certain regions of the world have had more increase than others, probably related to the amount of growth in the temperature. Here you can see 9 out of 10 worker exposures to excessive heat occur outside of a heat wave. So it doesn't have to just be super hot out. It just might be regular heat. And 8 out of 10 occupational injuries linked to excessive heat occur outside of a heat wave. So injuries and exposures just gives you an idea. These are just some other things from that United Nations report. I'm not going to go through all of these, but this is an example of they predict about 500,000 heat-related deaths have happened over the last 20 years. Like I said, I think it's grossly underreported. I know of many situations where the deaths have not been reported. And if they are reported, they're often categorized as cardiovascular deaths instead of heat stroke deaths, because it's a little easier for the country or the company to rationalize the death and not have that necessarily be their fault. So this is some other things, a great resource, this United Nations report, but it talks about different populations that tend to be the most vulnerable. So it's people who work in the heat, but also people who have to live in the heat without mitigation strategies. We did a lot of work to help the Biden administration and had previously helped the Obama administration as well with working on a new federal heat standard. President Biden hosted a summit at the White House where we were able to have a big role in September of 2024 where we participated in that effort. This is pictures from when I attended that meeting back in September. This is pictures from when I was at the White House during the Obama administration, where we were talking about climate change related specifically to sports. The previous one with Biden was a little more broad with labor, athletics, and warfighter issues. So when we're talking about some of these things related to laborers, we have to think about the organization, meaning the company you work for. They might have great mitigation strategies on their own, like a Delta Airlines, or strategies like, for instance, UPS has implemented. Things like state might have their own policies. So I'll show you a map that I think there's 7 states in America right now that have their own heat policies. And interestingly, Connecticut right now has a heat safety policy for laborers that's working its way through approval right now as we speak, actually. And then there's obviously the potential for federal standards. There is no federal standard right now for heat safety. Biden was working on the first ever federal heat standard over the last 4 years. This is an example, and there's a QR code of what the federal heat standard had looked like back when it was first released for the public in July of 2024. Some of the things that they were looking for in a heat standard are listed here. I'm not going to read these all off, but it's very similar to Dr. Morrissey's publication that I mentioned before. That's the best practice document from 2021. These are some of the things based on different thresholds of environmental conditions, orange, darker, and then red. And when those thresholds are reached, different things that a company might have to do. So again, this was just a proposal. This is not the federal law right now, but this is similar to some state laws that exist right now. These are the states that have policies right now. I think this is the most updated one. There might be one more state right now. This lists 7 if you count Nevada, but it's not in blue. And I mentioned to you Connecticut and a few other states are working on them right now. We've also worked closely with the Federation of American Scientists with their recent heat policy agenda. We had a chance to review it and make edits, and they included some of the edits from KSI on their recent things that they submitted recently to the Trump administration related to heat safety. Some of the things specific to athletics were added, which we were very happy about. So again, this could all be accessed at the Federation of American Scientists website. So I'm just trying to give you a broad stroke of some of the influence that KSI has had. This is an example of one of the most recent state policies that have been adopted. I believe it's the most recent one. It's Maryland. This is, again, you could see this as a roadmap. If we have people watching this right now who are in other states that might be looking for state legislative efforts for heat safety for their workers. I'm going to let this one go for now, just for time reasons. But some of the things specific, to talking about heat stress, you guys, I'm sure, understand. Like, we have the environmental heat, and these are things we can change work to rest ratios. But we also have the intensity of the activity that the person does. That's your metabolism. These two are the two biggest factors that influence the rate of rise of your body temperature, which is your hyperthermia. Okay, so this is things that you need to understand in different work settings, like in this publication that's really well done in terms of protecting vulnerable populations. We have to understand what is the intensity of the work, what are the environmental conditions that they're being asked to do the work in, so that we can understand what the risk model is. And then when we have that, we can also understand, what are obviously the risks for different heat illnesses, and we can start to understand the etiology and the epidemiology in those settings. Another population that we work a lot with at the Corey Stringer Institute are different human rights organizations. I wanted to mention these to you quickly. In Qatar, they hosted the World Cup in 2022. Well, back when they started building the stadiums back in 2013, I think, they didn't have heat mitigation strategies for their workers. So we assisted Amnesty International and Human Rights Watch, two of the largest human rights organizations in the world, with the heat information they would need so that they could present this to the organizing committee in Qatar and also to FIFA, obviously the sports governing body. And E60, which is an ESPN special, Jeremy Schaap was the host. On the first game, I believe in November 2022, they had a special to talk about all of the heat mitigation strategies that Qatar eventually developed, because Jeremy Schaap had been there 10 years ago when they were running into a lot of problems with building the stadiums. So when they were building the stadiums, they did not have proper guidelines in place for hydration, work to rest ratios, and very importantly, when the workers left their work shift, they did not have appropriate places to live, air conditioning, potable water, places to cook meals, to shower, things like that. So through all the mitigation efforts and meetings that Amnesty International Human Rights Watch led, thankfully FIFA and the organizing committee were proactive after a lot of deaths took place. And they built an $800 million facility that, if you watch the special, you'll see it in person. Jeremy Schaap walks through, where they have proper housing, showers, dining halls, potable water, and obviously made a massive change in the ensuing decade with preparing these stadiums for the World Cup. It also is an important lesson that when the Olympics offer cities to be hosts, and the World Cup does this, and other big sports organizations, or festivals, or cities hosting big concerts and parades, that you need to have plans in place for the people participating, like athletes and the workers, but also people who are spectators, people who are volunteering when the event actually takes place. These are really important mitigation strategies to consider. So I mentioned to you, Human Rights Watch was another one that we assisted with. Something that's meant very important to me when, after that, assisting, Human Rights Watch sent something to KSI thanking us for the assistance through those very important years, getting the Qatar to change some of these policies and obviously work very hard to protect these workers. So this is just another example. You could Google these things, Human Rights Watch, Amnesty International, Qatar World Cup, and a lot of the heat mitigation strategies would come up. So to summarize some of the work that we've done and some of the things we need to consider for the future, I like that this kind of the call for heat adaptation and changes. I can't read through all of these right now, but it's a really in-depth look at what counties could do, work settings, states, national organizations, national governing bodies, federal governments can do to consider all the different facets that we might have to consider with global warming and the different people it's going to influence. And these are the different groups that we've often pulled together in these settings that have had a vested interest. There are companies that make cooling products. There are companies that make temperature assessment devices that they're interested in getting their products to these people. There's governments, city governments, for instance, that don't want anything bad to happen to their workers. One, because they care about them. Two, because it's going to change the structure of workman comps and insurance claims and cost to run their operations. But there's a lot of other groups that care about this as well, and groups that we're trying to get involved to make these changes. Dr. Orr, Madeline Orr, is hosting a work group in South Africa in June to specifically look at how climate change impacts sports. And she has an amazing book that you could Google on Amazon that looks at how climate change is influencing sports around the world. And she talks about the probability and consequence of climate change impacts. And it talks about the frequency of extreme heat precipitation to a particular area and organizational climate capacity, the adaptive capacity of an organization to accommodate changes in climate. Okay, so the organizational climate capacity, meaning what is the organization thinking about in terms of gradually increasing environmental conditions and how it impacts the sport that they're hosting. So I think that's something really important. They call it a climate vulnerability to sports organizations, or CVSO, and it's the practices, the behaviors, and the policies that are in place. And so this is the things like we do with Tufts with state policies. It's things that FIFA and the IOC need to consider when they're having different host cities. When you have Qatar hosting a World Cup and for soccer and a World Championships in track and field, you know you're going to have massive heat issues, not just for the participants, but for the workers as well. Same with when you have the Olympics in Tokyo or in Paris during August. I think there's a kind of an irony that when the Olympics were in Tokyo in 1964, they moved the Olympics to October. Okay. When they had it in 2021, they had it in the end of July and the beginning of August. Okay. So not only was it warmer, 60 years later, but it's in a much warmer time of the year because they didn't move it to a cooler time of the year. So these are things that we have to consider and what influence it's going to have on people. All right, I think I stayed pretty close to my time. I did not expect Elaine to read my bio for 5 minutes. So thank you, Elaine. So I want to say a huge thank you. I don't know if we have time for questions. You could always email me as well with questions, but I want to say a huge thank you to InCHIP for this opportunity. And hopefully this was eye-opening in terms of some of the work that KSI does. Thank you.
Fantastic. Thank you so much for joining us today. And we are just so privileged to have you here at InCHIP, but also at UConn, and to call you a colleague. And it's lovely to see the tremendous impact that your research and your team has had on heat safety around the globe, in saving lives. And there's nothing more important than that. So just bravo. Really great to hear about the future. Well, thank you.
Thank you very much. I appreciate that, Trisha.
What I'd like to do is just open this up to anybody who might have questions. We have about 15 minutes left, just shy of 15 minutes. So if you have questions, please speak up, or you're welcome to write in the chat. Dan.
Hi, that was really interesting. Something I've been thinking about for a long time, and it's just great to see the research and everything that's going on. This might be a sensitive question, but just wondering, with the new administration in place, and a lot of the word climate is being sort of taken out of a lot of things, and just wondering if you think that some of this will still continue to move forward nationally in terms of some of these policies. I know the states obviously have their own decisions that they can make about it, but just wondering what you think the federal landscape is going to be going forward about these issues.
All right, Kim, no holding back, right? So I do think most of the changes we're going to see now are going to be at the state level over the next few years. States that are really proactive with wanting to protect laborers. And remember, protecting laborers means they're going to be more productive, and it's going to decrease your costs associated with short-term and long-term healthcare, for both within the job setting and for state health costs as well. So I think that's where we're going to probably see most of the changes, but also companies themselves are very proactive because they're starting to see, again, cost reduction associated with heat mitigation strategies. That is where I think probably during the Trump administration, we're probably going to see most of the stuff happening at the state level right now.
Thanks.
Mm-hmm.
Question for you. So I'm really interested in the demographic differences in terms of heat vulnerability, but it sounds like the science is truly in its infancy in that area. You mentioned, some just getting to research differences in male versus female gender. And I'm also curious, is there any research that has been done in terms of racial ethnic differences? I'm thinking about some of the manual labor, or some of the, the labor that are in more extreme environments, and how there are racial and ethnic differences, and whether we know if there are differential in terms of people vulnerability.
That's a great question. So a great preponderance of the deaths happen for non-union workers. I'll tell you that to start with. So being in your union is massively protective to staying alive while you're working. So that's probably not surprising, because the union could advocate for hydration and breaks and things that would be protective. You may or may not know that farming is the only industry in America that's illegal to unionize. So I mentioned that because farming is probably, I think, the most vulnerable population in America in terms of where the most deaths take place. And probably a lot of people in that work setting are probably what you're referring to. There are probably a lot of lower socioeconomic individuals laboring in those settings. So I think that population is probably the most vulnerable, the one that we should work the hardest with protecting. And like I said, it doesn't have to be complicated. It literally could be some cooling towels, a hat, and cold water, access to cold water through the day, and maybe some shade that is available during breaks. And it could be super simple, and your workers are going to be way more productive and healthier through the course of the day and do better work.
Interesting. I wasn't aware that they don't have unions. And so just as a quick follow-up, so there's health services groups that provide a variety of different health related intervention or service or prevention to farm workers. Do you know whether this has been an area of focus for the health services group?
I do not know that. That's a good question. I would have to look into that more.
I think so.
Mm-hmm.
For Doug.
No more questions right now?
Additional questions?
I would tell everyone to keep their eye on Connecticut trying to pass heat safety for laborers, which is exciting. We had a chance to review the bill. One of my colleagues here at KSI was able to testify in Hartford related to some of the elements of it.
That's fantastic. It's so great to see some of the research that's been happening at UConn actually impact policy and good in the state. Wonderful. Well, thank you again, Doug. It's just delightful to hear about your work, and really appreciate your time, and look forward to following this through the next few years.
All right. Thank you so much for the opportunity. Very, very grateful.
Be well. Thank you, everybody, for joining.
Bye-bye.